Okay, welcome everyone. We're going to talk today about the circulatory system, which is the cardiovascular system. Most importantly, that we need to get out of this lecture is understanding or knowing these 5 points, even though there's more information in there. But what we need to get out of this is these 5 objectives. So first, we're going to learn the parts of the cardiovascular system. That is the anatomy, which is the structure of the heart and the veins and the vessels and the arteries that run to and out of the heart, and as well the anatomy of the heart itself, the chambers and the atrium. Second, we're going to describe the structure of it, which is the inside of the heart, and the difference between the 5 classifications of blood vessels, on the size of them, right? They have different names. So that's pretty much all the anatomy part. Fourth, we're going to describe between the cycles that the heart runs. We got pulmonary circulation and we have a systemic circulation. Pulmonary has to do with the lungs, so the circulation and the relationship between the heart and the lung. And the systemic circulation is the relationship between the whole body and the heart. And describe the basic functions and composition of blood. So what is blood made of and what is the function of every element in the blood? Simple as that. Sounds good? We are about 1, 2, 3, 4, 5 people. So I'm going to do an exercise just for about 30 minutes where you can go into the chapter and do some reading, but I'm going to dedicate 1 for each person. Would you like to pick your number or shall I give you a number? Well, I'll give you a number. Okay, so let's list the parts of the cardiovascular system. So let's have Robin gonna read about that part. Okay, when we come to questions, we'll have you chime in. Okay, Tony, you're gonna describe the structure of the heart. Marie Leslie, you're gonna do the difference or differentiate between the 5 classifications of blood vessels. So the types of vessels that are in the body. Yuri, you'll do number 4, which you're gonna describe. You can also go to the just that part in the book, okay? That talks about the pulmonary circulation and about the systemic circulation. And that leaves us with mahogany. So I need you to whoever is here saying yes, to say yes.
Yes.
Okay, good.
Good.
All right.
But we're getting this information from the manual or from the actual book?
Yeah, from the actual book. So I just want you to jump into that part.
Okay.
Okay. So who did I get now? Yuri, I get you number 4. After Yuri, mahogany, number 5. Yes? Or did I give it to Leslie? Nobody's talking.
I didn't get anything, but I
Okay,
have
so
a book, so
you have the book, Nora, right?
yeah, but it goes from chapter 4 to chapter 8. I don't have anything
No
between.
chapter
Remember,
5.
I got a copy.
Nothing to read. Okay, and nothing to okay, so it's very simple. So you're gonna do number 5 and you're gonna go on Google or ChatGPT and just type in that question.
Okay.
Exactly as it's in, and then we'll see what they come up with and we share in the book. Okay, who else didn't get something to read? Okay, nobody's talking, then that's what we're gonna do. I'm gonna give you about 25 minutes to kind of just read, go through the book. This way I know who's in here is not here, and then we'll go into this. This way you're introduced to the material, and maybe I'll try to put the workbook on the PDF or something so you guys can see. Sounds good?
Yeah, can you show the previous slide with the 1, 2, and 3?
Yeah. It'd be nice if I could put both of them together, but I don't know if I can put two.
It's also the questions in order on page 203.
Exactly, yeah. They
Yeah.
are on the page 203. There's 11 things there, but we're gonna focus on 5 today.
Got it.
Okay, thank you actually for pointing that out. Anybody have a question? No? Okay, we'll see you guys soon.
Take a deep breath. Exhale. take a deep breath. Exhale.
Alrighty. System number 4, which is the circulatory system, one of the most important systems of the body. And we're going to dive into it today. First, we're going to list the parts of the cardiovascular system. We're going to describe the structure of the heart and the difference between all the blood vessels in the body. We're gonna go and dive into the difference between the pulmonary circulation and systemic circulation, as well describe the basic function and composition of the blood. The chapter will also include the relationship between, or the parts that includes the lymphatic vascular system, because lymphatic system and vascular system work together. Then we'll explain the function of the lymph system, describe the circulation of the lymph from the intestinal spaces until it returns to the venous flow, back to the blood circulation. And lastly, we're going to explain the function of the B and T cells in the immune system and the stages of HIV, AIDS, and transmission of diseases, as well pathologies of the cardiovascular system. So blood vascular or cardiovascular system can consist of the blood that runs through our veins, to our heart, and the heart itself and the blood vessels. So 3 things: the fluid, the pump, and the tubes, which is the vessels. Where the lymph vascular or the lymphatic system, you're more familiar with that. It's the lymph, the fluid itself, the nodes, and the lymphatics, which spleen, thymus, the tonsils, the adenoids, and the prayer patches. So these are like pretty much the organs of the lymphatic system. So the cardiovascular system it's considered a closed circuit system. That means the blood flows through the same circuit. It does not leave the body and enters back the body. It stays within the body in a circular motion. It consists again of the heart, arteries, veins, and blood. And it continuously circulates, so it nonstop. The heart and the brain is one of the 2 organs in the body that technically work nonstop, especially the heart. Because if the heart stops pumping, then we don't have the exchange of oxygen in our body, and the nutrients will not reach the organs. So the heart, let's take a look at the heart. What does it consist of? First, we're going to take the membrane or the outer or the wall of the heart. We're going to see the most inner layer is called the endocardium. The middle layer, which is the muscle itself, called the myocardium. And we have the outer membrane right here, which is the pericardium. As you can see in the pericardium, there is the visceral, which is the deeper layer, and the parietal, which is the outer layer. And between the outer and the inner layer, there's a cavity where fluids run through it. We're going to go in the book and highlight more details about it. So when we look at the heart, we're going to see that it consists of 4 chambers right here. 1, 2, 3, 4. And we are looking at the heart as if you are looking at a body in front of you. So let's say somebody's laying in front of you. This is going to be their left. It's not, but if you're looking at the computer, it's going to be your right, yes? But we are looking at the heart as if we're looking at a body that's laying on the table. The left is smaller, while the right is larger. The top chambers are called atriums, left and right, and the lower are called ventricles. So think of the letter V for ventricles and A for the atriums. So the blood comes in through the heart and then out of the heart into the left, let's say, side in and out, and the same happens with the right, with the left side in and out. Sorry, right side in and out. Left, there's in and out. And in between, you can see that there's valves right here. And the purpose of a valve is to prevent backflow of the fluid or the blood back into the atrium. That means it expels it. And if ever the heart wants to push the fluid back, ventricle to atrium, it will not happen because the pressure will close the valves. And that also in construction and all other places where they use the word valve, and that's what a valve does. Atrium is always going to be pushing down the blood. So beside having arteries, which are the largest arteries, like the aorta, which is the largest artery in the body, where it pumps rich oxygenated blood to the body, okay? To the general circulation. So the blood that is being pushed from the aorta is to supply for the general circulation to the body. As if you see the blue color, that means it's a deoxygenated blood, lacks oxygen. We have, so the two larger vessels in the body are going to be the aorta and the vena cava, the largest. Aorta takes the blood, rich blood to the body, where the vena cava, it collects the poor blood, okay, from the heart. Again, the aorta pushes the rich blood to the body, and the vena cava collects. Other part anatomy of the heart is you're going to see that it has those, the mitral valve, that one that separates the atrium from the ventricle on the left side. We have the aortic seminar valve. It's a 3-flap valve. As well, there's one here on the other side with the pulmonary semilunar valve. That is going to be also a 3-flap valve. So these are 2 flaps and these are 3 flaps. So the blood vessels, we said they go from larger to smaller, So arteries and veins are the largest. Then they will branch out into something called venules or arteries like these. So the big or the large artery will branch into arteriole, and the large vein will branch into venules. Now, what happens on both ends is where the venules and the arteries meet together. They meet together in a smaller blood vessels called capillaries. They're called capillaries on both ends, on the arteriole side and on the vein side. That's where the exchange happens. Okay, we'll go through that. We're going to test our pulse after and do the activities after. Major blood vessels that we need to be aware of and know. As you can tell, there's a lot of blood vessels, but our main ones to understand is there is a supply of larger blood vessels like the carotid that goes up the neck to the head. So if we, for example, cut circulation on that, it's super dangerous. You could definitely feel that, and we're gonna palpate it together and get our heart rate. You got the brachiocephalic artery that supplies the arm. Have it on both sides. The aorta, of course, is the main supplier of the rich oxygen blood, and the arc here, so it's called the arc of the aorta. So there's ascending and the arc itself. On the abdomen side, or let's say underneath the diaphragm, you have the thoracic, which supplies the thoracic. You can definitely feel the pulse on there, as well as you can feel the pulse on the abdomen, right on the belly button. You'll be able to palpate close to that and palpate those. So as a female is pregnant, we usually be cautious and aware of not compressing this main artery, as well with the vein that we're going to show you right now, which is the vena cava, because they're going to be the main highways or the main vessels that's going to take the blood to the heart and away to the extremities. So compression on that area considered dangerous. So we be careful with our pregnant ladies. Okay, branches, larger branches from the abdominal aorta, it's gonna go down into your iliac, to the iliac region. It is the same one, it kind of changes names because it changes region. And then it gonna branches down to the femur, to the thigh, so it would be called the femoral branch. Around the knee, it becomes the left patellar, right patellar. And as we go down to the lower leg, same thing, the peroneal muscle, peroneal region. You have this right peroneal artery, same thing on the left. You can actually, I was on, I want to say I call it a field trip. I was on call working when I was training for to be an EMT. And we went with the fire department to an elderly home. And I pretty much saw how they kind of do that, kind of tap into the bone and get to the blood supply from there to administer the, I don't know what they were giving her, but yeah, unfortunately she died. But you can access blood supply straight through these arteries. Okay, so these are the main ones. And let's move on to the vessels. We'll look at the vessels. Again, will they ask you about all of these? Not really, but they'll ask you about the flow of the heart, step by step. And then we're gonna write that down so we don't forget it. But same thing here, as we have supply with oxygen to the body, we have separate vessels, which called veins, that are gonna collect the deoxygenated blood. After we have used the oxygen, the body's gonna recycle the blood so we can transport in it oxygen and repeat the cycle. Okay, so we got the jugular vein, the largest, supplies the head. Right here, the brachiocephalic vein and the subclavicle vein. So these are the largest one, just underneath the clavicle. As they run up the underneath the arm, that's why these areas right here on the posterior triangle of the neck and the axillary area, we call them what do you call it? Area of caution, right? They're areas that we need to be careful not to add excessive pressure on because it's a fragile structure. As well, there's nerves too. In the veins, we said it's the aorta. In the arteries, we said it's the aorta. In the vein, it's the vena cava. So inferior is the one below the heart, and the superior is above the heart. It will run right next to the aortic vein as well. It goes down into the iliacus as well as the other one. It branches out. Definitely you can feel a pulse there very, very easily. And when a pregnant woman is pregnant, you'll be able to feel two pulses, one for the baby and one for the mother. Okay, from the iliac, it will break also to the femoral and to the saphenous vein. So more in medial, while the femoral you can see more in the anterior area. And it breaks down also to the peroneal underneath the leg and popliteal vein around the knee and dorsal vein to the feet. So that's why it's good to understand the name of the regions, because from the regions, they're going to name them bone, they're going to name the veins, they're going to name all sorts of things that are connected there to those regions. Okay, so the two circulation of the blood, we said there's pulmonary circulation, which is heart to the lungs, and then to the heart, and then you have the systemic, which is general, which is heart to body to heart. So in the pulmonary, the heart is going to collect the deoxygenated blood and it's going to pump it to the heart, and the heart is going to pump it to the lungs. The lungs will filter the blood, and then the blood will come back to the heart. Systemic or general, again, the heart is going to be already oxygenated. It will run to the body, and it will come back through the venules and the veins, and going to come back to the heart. And from the heart, it's going to go to the lung, and the lung to the heart. Then back from the heart to the body, and back to the heart. So between the pulmonary and the systemic, what happens is pulmonary is where the dirty work happens, and the systemic is where the transportation happens. And here is what they're trying to show you, give you a little closer look so you don't get a better idea. So we got veins, sorry, arteries and veins and capillaries. The capillaries where the exchange happens. So it goes to the heart, or the upper body is going to include the head, include the extremities. You got the heart and the lungs, that's where the pumping action happens, and where the filtration happens and comes back to the heart and to the body, comes back to the heart, to the lungs, come back to the heart, like that. But now we have one, the cycle, the circulation goes direction to the heart and also goes to the body. They kind of branch out at the same time. And when it comes down from the heart, it goes to the lower body, right? You got your internal organs, you know, your stomach, all these internal kidneys and lower legs. Then it comes from the lower legs and collects to the vena cava right there and back to the heart and to the lungs and back to the heart. The idea is simple, but then understanding the names and putting the names together and remembering the names is just going to take a couple of 2 exercises that we're going to do together. Okay, we're going to come back and discuss the disorders on the book, but they're pretty simple though. We got 1, 2, 3, 4, 5, 6, 7, 8 for the most part. From arthritis of the joints to the veins to the blockages of the, or blood clots in the veins, aneurysms are in the brain, cerebrovascular accident like stroke that happens, myocardial infarction, which happens to the heart, varicose veins, weaknesses of the veins, hematoma, and edema, both we're going to discuss as well with the fluid of the body. Okay. So I'm going to go to the book first and dive in a little bit deeper so you can highlight. And then we'll come back and discuss the blood. Okay.
Miss Thomas, good morning. I'm here. I'm just listening. I won't be able to participate because I'm at work, but I'm just listening for the class today.
Yes, perfect.
Thank you.
Okay. We go from the beginning. Okay. In the book, it's a little bit different order than the slides, but as we go, we're going to highlight, and you're going to highlight with me. Okay, the circulatory system got 2 main divisions of the vascular system. We got the blood vascular system, the cardio system, which includes heart, the blood, and the blood vessels we just talked about. Our next part is going to be about describing the lymph vascular system, the lymph system itself, and the nodes, the lymphatics, and all the other organs. And these 2 systems kind of link together, work together. So as the blood and the lungs deal with the blood in our body to be filtrated and come back with supply for the internal organs and the tissue, the lymph system is the cleaning system that's going to get rid of all the extra fluid. That's one of the jobs of the lymphatic system, is first to deal with the excess fluid. There is 2 to 3 times more lymph in the body than there is actual volume of blood. A lot of times you see people who think they're overweight when they're actually, their lymphatic system is completely out of whack. So they're collecting more blood, more fluid than they should, which is going to slow down both systems and both cycles. Okay, so the blood vascular system is a closed circuit, like we said, and we consist of 1, 2, 3, 4. Memorize those. Capillaries, veins, and arteries are called blood vessels. So it's blood vessels, heart, and blood. And the blood is considered an efficient pump that helps pump the blood so in a steady stream throughout the closed circuit. So continuously pumping and pumping. The power of the pumping of the heart is pretty much just enough to get the heart to initially to distribute it, but the rest of the movement of the blood is going to depend on the veins, or the blood vessels themselves. And the heart is conchial in shape. I'll have a really cool video I'm going to show you in a little bit on YouTube, where you're going to see the heart opens up into one big coil and back in. You can extend it fully into one long piece. And it's the size of your own fist. It's located between the cavity, between the lungs, and behind the sternum itself. And a lot of time we do CPR, that sternum breaks. But it's right underneath that, and it's most protection to the heart. Anyways, it is enclosed in a double layer membrane. So the membrane of the pericardium, so the heart has a membrane, as all organs do, but the heart is the pericardium. The inner layer, the deeper one, is the thin one. It's made of serous covering. So it's going to be like the epithelial tissue, very soft, where the outer layer is going to be more protective, and it's going to be made of connective tissue. It attaches to the diaphragm or to the structure around it, from the sternum to the diaphragm to the spinal column. Now, between the two layers of the membrane of the heart, which we call the cavity, the pericardium cavity, it has serous fluid, and that helps position the heart, and it allows it to move without any friction, just like in the knees and in joints. We have the synovial fluid to help to do the same thing for the joints. Okay, now the wall of the heart. So we got the membrane, the outer covering, and then underneath the membrane, we have the wall of the heart, which consists of 3 layers. One is called the pericardium. It's a protective outer layer, epi, above. So it's the most outer layer. Where are we? And this layer, okay, protective outer layer that includes the inner pericardium. This layer includes and supports the nerve, the blood vessels, capillaries, and fat that surrounds the heart, okay? Now the thick layer in the cardio muscle, it's called the myocardium. So cardium from heart, myo from muscle. And it's responsible for the muscular pumping action of the heart. So that's the only muscle in the whole body that never stops. And then the innermost layer is called the endocardium, okay? The epi is above, outside, endo, in, and it's the most deepest layer. And it's more smooth, protective covering that lines the chambers of the heart, the valves, and it continues with the lining of the blood vessels as well. I showed you a picture before, so now you have an idea. So this is the heart muscle right here. Muscle. And then the membrane right here, and then the wall right here. The chambers we talked about, the valves, and all of that flow. We're going to discuss right now how it flows. Okay. We said the inner of the heart contains the 4 chambers, as you see, 1, 2, and 3, and 4. 2 on each side, and 2 of each of the muscular walls called a septum. So that what separates them. So is the wall that separates the heart chambers. Okay, the septum that separates the heart chambers. 1, 2, 3, 4. Now the 4 valves in the body that allows blood flow to flow in one direction are 1. These I would highlight right away. So the triseptic valve of the heart allows blood to flow from the right atrium into the left atrium. Okay, a ventricle, that means from the top to the bottom. And it's going to be on the right side. It's the triseptic valve. Okay, and then we have the pulmonary seminal valve, which is positioned. You can highlight it on the heart direction, that directs blood from the right ventricle to the pulmonary artery. Right ventricle, I have it right here. I need the other picture. Open your book so you can be with me so I don't have to go up and down. If you open your book to page 205, you will see this way. I don't have to go up and down. Page 205. And then you have the biseptic or mitral valve, and that is the valve allows the blood to flow from the left atrium to the right atrium. Triseptic is going to be on the right side, while the triseptic valve or the mitral valve is going to be on the left. Awesome. Now, the aortic seminal valve situated in the close to the aorta, which permits the blood to pump from the left ventricle into the aorta, but not reverse. So all of them do the same. We're gonna go in the flow right now as we go through the next page, so don't worry. So these are the main valves. 1, 2, 3, 4, have those down. And I'll give you a chance to actually create flashcards on those. Now, the impulses that generate the heartbeat originate within the heart, and a normal heart rate of an adult beats from 60 to 80 beats per minute. On an average, athlete might be less beats per minute because they have a stronger heart and they can pump more blood than an average human being. Okay, now this is the picture I was talking about. It'd be much easier to see the picture and see where it separates and what. Okay, so the blood vessels, we got arteries, arterioles, capillaries, venules, and veins. And they kind of work that way. Large, medium, small, large, medium, small. And they meet at the capillary level. Transport blood from the heart to various tissues and organs and back to the heart. Okay, so I'm gonna try to do it here on the flow, but as we go to the next page, it's written one step after another. So don't feel it's too much. If you want to follow with me while I'm going through this, you can open page 113. In 113, it's going to say the course that blood travels. And this page is important because most of the questions are going to come for you is going to be on that page. They will trick you in many ways to come up with different ways to flow with the heart. And we just want to make sure that you don't get confused. Okay? All right, so let's start with that. This way, I will start with that page you have open. If you don't have it open, don't worry, just follow along. Or if you want to take a picture before we continue, you can take a picture. I think it's here. So whoever wants to take this picture, do so if you don't have the book, and I'm going to read from it. Yeah, it's up to a tiny bit smaller. Here we go. So you can, this one right here. How the general and the systemic come together. I will do it with you right now, okay? And after I'm done with the book explanation, we can do questions and both. All right. Beautiful. Okay, so let's go with number 1. Anybody's up to want to read it, or shall I kind of go with it? Okay, I'll go with it. I'll ask you questions in a moment. Okay, the course that blood travels is as follows. The right atrium. Okay, let's go to the right atrium. This is the left, this is the right. Right atrium. So you can write 1 if you wish, or you can put start as this is where you're going to remember where the circulation starts. So the right atrium receives oxygen-poor blood from the large superior and inferior vena cava. So the vena cava is going to collect blood from the extremities and the head, while the inferior vena cava is going to be from the organs and the lower limbs. They're all going to collect and they're going to dump into the vena cava to the right atrium. 2, from the right atrium, the venous flow passes through the triceptic valve into the right ventricle. So it's going to pass through the triceptic valve, this one, and then to the atrium. So that's step number 2. Step number 3, it says from the right ventricle, it's going to be pumped through the pulmonary semilunar valve. So from here, it's going to pump through the pulmonary semilunar valve to the pulmonary artery. Now, this is confusing, okay? But listen to me. That's the only one that's confusing. So let me finish it for you. And carries the pulmonary artery to the lungs to be deoxygenated. According to what I said, that the arteries carry oxygen-rich blood, except for this case, and the veins carry poor. So the blood that's coming from the right atrium, from the vena cava to the right atrium to the left, to the right atrium to the right ventricle is deoxygenated, and it's going to go to the lungs through the pulmonary, from the word pulmonary, but it's called artery. Maybe because of its size, but that's what it's called. So pulmonary artery, put an exclamation mark or put like a star and write on it deoxygenated blood, okay? Now we're gonna see there's a left and there's a right because we have 2 lungs. We have a right side and left side and the same thing, okay? So this is where the deoxygenated blood is going to go to the lungs. Number 4. The freshly oxygenated blood is collected from the capillaries into the pulmonary vein and returned to the heart. So, pulmonary vein, where's our pulmonary vein? Right here. So what happens is the deoxygenated blood goes from the pulmonary artery to the lungs, to the capillaries, venules, then capillaries, back to the arterioles, and then diffuse in the, let me take that 1 second. Everything gets diffused into the capillaries and comes back to the pulmonary vein. So vein is going to be oxygen-rich blood. And comes back to which side? To the left side of the heart. Now from there, after it went to the lungs and came back from the lungs, it's going to dump into the opposite side, which is the left atrium. Number 5, the left atrium receives the oxygenated blood from the pulmonary vein right here. Then from the left atrium, the oxygenated blood passes through the to the bicuspid or the mitral valve. Mitral valve is easier to remember. And into the left ventricle right here underneath it. Now, from the left ventricle, number 7, the blood is pumped through the aortic semilunar valve and into the aorta. So you can see there's a valve here. So nothing is like, it's like doors from one room to the next. You're going from one room to the next, a corridor, a room, a door, kind of like that. And you're going through the semilunar valve, the aortic one, to go up to the aorta. Number 8, now from the aorta, so this is now the beginning where the rich blood is going to be pumped to the body. So from the aorta, the blood is distributed to the major arteries throughout the body, except for the lungs, of course, because we took it from the lungs and now we're going to take it to the body. The blood moves into ever smaller branches of the arterial system until it flows into the arterioles, which is the smaller branches comes from the arteries. Okay? Now, number 9, the arterioles, the blood moves into the thin-walled capillaries, which is the smallest, where the oxygen, nutrients, and fluids move into the tissue spaces, and the metabolic wastes and carbon dioxide are reabsorbed into the bloodstream. So what we do here is we send that blood to the body so we can use what? Nutrients and oxygen. And then what happens is we release metabolic waste and carbon dioxide back to the bloodstream. So it's blood with no oxygen and less nutrients, and it's going to be run back to the vena cava, down from the right atrium, forgive me, right atrium, right ventricle, through the pulmonary semilunar valve to the pulmonary artery, back into the pulmonary vein, into the left atrium, through the mitral valve, down to the left ventricle, up again into the aortic seminal valve, to the aorta. Okay, hope that's helpful. Alrighty, so blood vessels and blood vessels like arteries and arterioles are similar in how they're structured, okay, and the layers of them. Capillaries, not, okay, because they don't contract like the blood vessels, the veins, arteries, venules, and arterioles, okay? So the innermost layer is made of endothelium, like epithelial tissue, okay? Where the middle layer is smooth muscle tissue, that's the part of the vessels that contract, because as we talked earlier, the heart pumps, the big pump, but the blood continue pumping not because of the heart, or the blood doesn't reach all the way to the extremities because of the heart. It's because of the blood vessels. And the outer layer, it's a protective connective tissue layer, just like you've seen on the heart. Okay, and there's over 60,000 miles of blood vessels that makes up the circulatory system in your body. So if you would run those veins and vessels on a line, we'll collect 60,000 miles to get there. Okay, now the smooth muscle tissue wall of the arteries and arterioles is richly supplied with nerves from the sympathetic portion of the autonomic nervous system. So the sympathetic portion of the nervous system is the fight or flight, and the autonomic nervous system is the automatic functions of the body that you don't have a say in. Now, these impulses can be sent to the cardiovascular system or to the blood vessels so impulses from these vasomotor nerves, nerves that has to do with vasorestriction or vasodilation, cause the smooth muscles of the walls of the arteries to contract and reduce the diameter to limit the flow of the blood. And this action is called vasoconstriction, right? Like a C, constriction. They'll start to get smaller. Now, when the nerve impulse is sent as an inhibitor, the muscle relaxes and the diameter gets larger. It dilates. And that would be called vasodilation. Now, capillaries are not like venules and arteries and veins. They're a little simpler, smaller, they're microscopic, and they have a thin wall and net of arteries and venules. And these capillaries are permeable, meaning allows things to go through them. And most important function of the capillaries is the two-way transport of substances. We talked before that what's one of the job of the membrane is to allow for things to flow in and out of the cell or of the tissue. So in this case, we have fluid, sorry, we have between flowing of blood and the tissue fluid surrounding the cell. And these walls move substances through three processes. One is called diffusion, the second one filtration, and through osmotic pressure. Now, the process of diffusion, go ahead and highlight those. You can also make flashcards. It's a process in which substances move from an area of a higher concentration to an area of lower concentration. So it starts to get diffused. In our case, it's oxygen and blood. Okay. Here, substance move from an area higher to lower. Blood enters the capillaries on a higher concentration of nutrients and oxygen than the fluid surrounding the cell. So the oxygen and nutrients diffuse into the cell spaces. By the same account, the concentration of metabolic waste produce carbon dioxide and more highly concentrated in the tissue. So in other words, diffusion happened both ways, by taking in the nutrients and by expelling out the waste. Filtration, this is another process in which blood pressure pushes fluid and substances through the capillary wall into the tissue spaces. So the pressure of the blood, especially at the junction, so where two things meet together, when here it's arterioles and capillaries, so the bigger to the medium to the small, tend to push fluid and substances through the capillary wall and into the tissue spaces through the process of filtration. So like a filter kind of goes and allows certain things to go through it. Now, because of the higher concentration of protein and other substances in the plasma, there is osmotic pressure created that tends to draw water into the capillaries from the tissue spaces at the same rate as the blood pressure flows out. Okay, so let's not worry too much into that. Just understand the three things. I'll explain the third one in a second, but this is how the anatomy of of the valve and the veins. So the veins don't run both ways; they run one way. Okay. So what happens? The valve, as the pressure goes through the valve opens, and the pressure goes through. Now, if there's not enough pressure produced by the vessels for whatever reason, and the pressure falls down, it's gonna pull down at the bottom of the valve right here. The valve will close right shut. It won't allow for backflow. And sometimes when we have vigorous veins or we have weakness in the vessel, that would tend to happen. These valves tend to get weak, as well as the arteries, the walls of the veins get weak. Okay. Let's move down a little bit here. So venules, veins and venules. Veins are larger, venules are a little bit smaller. They are thinner walled blood vessels that carry the oxygenated and waste-laden blood from the various capillaries back to the heart. That's all we need to know about it. We went through this map, but here's a closer look to kind of get an idea of the supply of the main arteries where you can get your blood, measure your pulse. Okay, and to get more closer into the names. As you can see here, we got the main artery, which is the common artery. It's the carotid artery. It's right here on your neck. If you just place your hand a little bit laterally to the neck, and you can feel a pulse. You can place 4 fingers just right underneath your, like let's say this is your, trachea just to the side of it, and you can feel a pulse. And that's your carotid artery. Now, as you can see with the names, each bone has its own supply of artery. Occipital bone has a supply of artery, and the artery called occipital. The temporal, right here. The parietal, right there. The frontal artery and the frontal bone, suborbital artery right on top of the suborbital arc right here. infraorbital right underneath, and that supplies one. And what you got here? We got the lingual artery and the facial artery right here that supplies and extends over to the rest of the body. But what happened to the rest of the region, that as it crosses different bones, it has a different name. Same thing with the main artery, that when they go down to the limbs, it changes. This way we know which region of this artery we are talking about. More into the exact branches are listed here for you, and functions in detail. We do not need any of that to know about in your exam. It's mainly just the blood flow and the job of the heart. And we can see here the veins. We got same story, the occipital, where is it? The temporal, the facial. Instead of carotid, we have jugular, kind of the same. We talked and I showed you the circuit of the blood, but they will ask you what's the difference between the pulmonary circuit and the general systemic circulation, okay? We talked about the flow of the heart, and let's talk a little bit about the disorders, and then we'll take a break. Okay. So arteriosclerosis is a condition. Arth has to do with our joints. So it's characterized by an accumulation of fatty deposit on the inner arteries, on the inner wall of the heart. So it's like a plaque, we call it. It becomes, it attaches to the wall and narrows the diameter of the artery. So the development of the deposit called plaque seemed to relate to the level of cholesterol in the blood. Plaque, cholesterol. So, and the deposit, which is the plaque, interferes with the blood flow, and that's the problem, okay? And create on the surface where blood clots may form. And the walls of the affected arteries tend to thicken and become fibrous, so they kind of lose their elasticity. And that gives it the arteriosclerosis name. Okay, what else? Okay, here, this is important, that other outcomes of this disease, okay, until it has progressed to a point that its related condition appears, occlusion of the coronary artery. So coronary artery is the artery that supplies the blood to the heart, and called angina pectoris, or a heart attack, okay, if ever affects the artery. Also, it can cause thrombus, which is a clot. And it might break free, and then a clot can become an embolism. And so it affects the wall of the arteries, okay? And if it ever happens to the brain, so if that happens in a brain, a stroke results in the heart and a heart attack occurs. If it happens in the lungs, and it's pulmonary embolism. So in the brain, it's a stroke, and in the lungs, it's an embolism, okay? Now, what can you do as a massage therapist? Circulatory massage is contraindicated for people with advanced arteriosclerosis because you're gonna increase the blood flow that they can't handle, okay? So if a prospect client is under a doctor's care, care of it is taken care of, like medication, in other words, then you probably need to also get clearance from the doctor to see if you can proceed. Okay, that's why it's sometimes important to ask people if they're taking any medication and when was the last time they had a massage and all that stuff. Okay, phlebitis. It's inflammation of the vein. Phleb is vein, phlebitis is inflammation of that vein. Could be from injury or surgery or infection. And the symptoms include pain and inflammation along the vein and swelling. So it's the classic symptom of inflammation. Thrombophlebitis from the name, so it's inflammation of the vein, but accompanies a thrombus. So it signifies the presence of a blood clot in an inflamed vein. Now, it's difficult to determine whether the clot is caused by the result of the inflammation or the injury, but thrombosis usually occurs in the lower limbs and can affect the superficial and deep veins. So you might be able to see it because that leg might be swelling, might be red as well. So it kind of will look off and you should ask. And if they do have it, you do not work with it. So again, a major concern of the thrombophlebitis is that a portion of the blood clot can break and you can put somebody in danger and break that thrombus and becomes an embolism. And if it travels, there's nothing you can do about it. You can't stop it. It has traveled and you're going to make a block or a clot somewhere. Again, symptoms of the thrombo varies. In fact, first symptoms can be those of the pulmonary embolism, which is shortness of breath, pain in the lungs, and coughing. So it will be also tender to touch and feels like hard cord. It doesn't feel like a vein anymore. So it can also have a deep achy pain in the area of the clot. You can definitely see edema in the distal, meaning in the lower section, where blood flow is going to be inhibited. So it's a serious condition, and massage is systemically contraindicated. Yes, because we can systemically activate the circulatory system. Alrighty, next one, aneurysm is a local distension, like a bend, okay, a bend or ballooning in the artery, and it's local. It's just in one area, or you call it ballooning of the artery. And also a weakening in the wall, because the wall cannot keep its shape, so it kind of does this distension or this ballooning. And it's most common and occurs in the abdominal and thoracic cavity region. The most serious consideration with the aneurysm is that could rupture, which cause internal bleeding and death, and massage is contraindicated. Now, you can't really see those arteries if it's somewhere else in the brain or anything like that. So it's not always visible that you can see the aneurysm or the ballooning of the artery. So move on to the next one. Cerebrovascular accident, CVA, which is a stroke. So the stroke happens from disturbances in the cerebral circulation, which is the fluid. And that could be from a blockage that happens from an aneurysm, or from hardening of the arteries, or from bleeding, or from a rupture, which causes bleeding, okay? And these symptoms can vary in the area and can include unilateral weakness, right? You know, if somebody has a stroke, you know, they cannot like move one part of their face. They feel paralyzed, they feel numb, dizzy, and confused. These are 4 important ones, signs of the stroke. Okay, 5, and you can put those in a card. 6, 7, we have 7. And blurred or double vision. Blurry, so the vision, mind confusion, dizziness in the body, numbness in the nerves, not being able to move, and weakness in the muscles. And paralysis like in the face usually. Okay, the after effect of the stroke depends on several factors. 25% of those people, of these, so about 25% of stroke have no lasting effects, so they cannot get over them after the condition has been taken care of. 50% result in physical impairment where they need physical therapy, and 25% of strokes, people die. Okay. Disability of this condition going to include partial or full paralysis of the body, a portion or a little bit of a memory loss, loss of ability to speak. So they have to kind of do speech therapy, physical therapy, all that stuff. And personality can change from mild to extreme, and that definitely need medical care. Now, massage in acute stages is contraindicated, but it's very beneficial during rehab. So technically, you need to get medical clearance, because if somebody came to you and said, "Oh, I just had a stroke," blah, blah, blah. Okay, did your doctor clear you to have or receive a massage? And if it's a referral, then you're cleared. That's great. If you're not sure, then you need to ask them if you could talk to their doctor to get clearance. Myocardial infarction, the next one, which we call the heart attack. Myocardial, the heart muscle infarction. So what happens? It's reduction of blood flow to the artery of the heart, which is called the coronary artery. It's the only artery that is dedicated to the heart. So what can happen is it's an obstruction of blood flow. So it's a result of reduced blood flow, and it can happen through arteriosclerosis, vessel narrowing, embolism, all the things that we mentioned before. What happens is there's going to be a lack of oxygen from the blockage and nutrients, okay? Which then the body can't pump. Body can't pump, then the circulation stops, and slowly you start to muscle starts to die. So the seriousness of heart attack is determined by the location and the extent of the damaged tissue. Symptoms will include pressure, achiness around the heart, radiation into the left arm, back, and jaw. Okay? So symptoms of radiation, pressure, and pain in the heart. Usually people will be holding their heart. They can tell that something is really up. Massage, of course, is contraindicated to the acute, but when they want to improve through rehab, through supervision of the doctor, then you can do massage. Varus veins are very common. They are protruding bulbous, so deformed looking veins. They're superficial, they can be seen, especially in the lower leg. People go through surgeries to kind of tone those up, but they tend to be painful. Extensive back pressure in the vein from the prolonged standing or blocked blockages causes the vein to enlarge and stretch to the point that the valve become incompetent. So that's what we talked about. The valve tend to have a one-way movement of any sort, helps push the blood through to the valve. But if the body is not being stretched, compressed, joint mobilization movements, all these things, squatting and extending, and the body staying in just one position, standing, then the body now is accustoming to not moving, and there's no way for the blood to be pushed if you're not actively pushing it. It's going to adapt to your everyday movement. And in this case, if you're not having enough movement, the veins are gonna, or the valve in the bottom, they're gonna start to hold more pressure, more fluid, till they kind of lose their tone. So shaking is really good. Doing scrubbing for your tissue is really good, because as you do the scrub, you're doing back and forth movement that helps with circulation. The vibration add a little bit of tone to the veins. So that's why exercise is recommended, not just to lose weight, but to keep those veins moving. So you need to move even on a cellular level. Even the cell needs some sort of movement to expel things. So move, my friends, move. Okay, we reach into the lower leg. The weight of the blood they will distend the vein. Okay, we talked about that. Now, severe varicose veins are contraindicated, means if they're really bad. Uh, but all but light massage. So if you do light massage with no pressure, not like as if you're applying lotion type of pressure, that is okay. But any massage as kneading into the tissue and doing aggressive petrissage, anything like that, no. Darkened veins are not elevated or painful or small. Isolated spider veins are safe for moderate or light pressure. So anyway, just be careful. If it hurts, just don't do it. Just make sure that as if you're always checking in, how's the pressure? Is this pressure is good? And you go with the direction of the blood flow always. You don't need to go back. It's already weak. You need to always be pushing and pushing towards the heart. Hematoma and edema, these are the last two. So hematoma is a result of bleeding underneath the epidermis. So it's kind of superficial bleed. Okay. It's common to refer to as a bruise. And it has this black, blue, purplish color, and it's localized to the area. Super simple. You've hit yourself, on a corner of the bed. How many times have you done that? So it's superficial. Okay, fades in, so the yellow fades to greenish yellow as macrophages, which is the white blood cells, move into the site to clean up the debris, okay? Deep hematomas or deep bleeding between the muscle sheaths might show discoloration but are painful to touch. So it means it happens, below the superficial fascia into the muscle. Massage is contraindication during the acute because it's still inflamed. However, it can appear gently around the soothe area to promote the. So you can have to wait to the subacute stages, so when the inflammation has done, to apply gentle, soothing massage. Ice is amazing, and all that stuff. Edema, last one, is a condition of excessive fluid in the interstitial spaces. It is characterized by swelling of the tissue because of excess fluid, right? We said the cell expels tissue, it expels fluid for waste, but as well, it's swimming fluid because that fluid, the cytoplasm, it has a nutrition as well in the cell for the inner cell. So this fluid needs to be expelled out. And the edema is characterized by swelling of the tissue and excess fluid. Causing edema is imbalance of fluid pressure within the capillaries. The imbalance pressure. And that can cause obstruction of the vein or the lymph vessels, right? Because they're having too much fluid within the vein that it can't handle the work. Now, high capillary pressure or porosity or kidney malfunction can result in fluid retention. So these kind of conditions. So kidneys kind of help filtrate, right, fluid in the body. Also can be caused by weakened heart, congestive liver, chemical imbalance in the body. Most common, you're going to see people with injury, infection. All that stuff can cause imbalance in the fluid in the cell, in the capillaries. Now here, edema is a local contraindication for massage therapy. Some types of edema respond well to specialized lymph massage techniques. Okay, but when we're talking about any inflammatory things, we do not massage, right? In this case, we have a pooling of the fluid, and we just need to help the body to get rid of it. Some cases we can't. We need to take doctor's approval. But if it's extremity, anything like that, it should help them. But again, always make sure to see if they're working with their doctor and how bad is their situation. Okay, awesome. What we're going to do next is take a break right now. So I'm gonna stop the recording.